Hello, everyone, and thank you for joining the 2025-2026 open enrollment meeting for Tampa JCC and Federation. My name is Mary Murphy. I'm your dedicated account executive over at Brown & Brown. We handle the insurance for Tampa JCC and Federation, and today I will be going over the Employee Benefits Guide. This is also available to you in ADP under the Forms document section if you need a copy. So let's go ahead and get started. As I mentioned, right now is your annual open enrollment period. So beginning May 26th through June 9th, you have an opportunity to enroll in benefits. So this includes adding coverage, removing coverage, adding dependents, removing dependents. This is the one time per year that you are able to make any changes to your benefit enrollments. Outside of the annual open enrollment period, you will need to have something called a qualifying life event in order to make any adjustments to your benefits. So that's right here at the bottom regarding qualifying life events. So this would include things like marriage, divorce, birth, adoption, death of a spouse or qualified dependent, or changes in your current benefits, meaning if you're currently enrolled, or I should say your current coverage. So if you're currently enrolled under your spouse's plan or maybe your parent's plan, and your spouse goes through open enrollment, or you age off of your parent's plan, that would give you something called a qualifying life event that would allow you to enroll on Tampa JCC's plan or terminate Tampa JCC's plan mid-year outside of open enrollment. So it's very important that during this time, during open enrollment, that you review all of the benefits that are available to you and do your best to make the best elections and that you can for the upcoming year, because you are locked into these elections until July 1st of 2026, unless you experience something called, like I mentioned, the qualifying life event. So please make sure to review all of the documents that are available in ADP in addition to this benefit guide, so you can make sure that you're making the best decisions that you can for the upcoming year. And then just a little bit more on this page. If you are a new hire, you need to work a minimum of 30 hours per week in order to be eligible for benefits, which take effect first a month following 60 days. And you are eligible to enroll your dependents, including your legally married spouse and dependent children up to age 26. Next page is just a reminder of the employee perks that are available through Tampa JCC. I will review this as we go through the benefit guide, but Tampa JCC offers you one time your annual salary with a maximum of $35,000 and a basic life benefit. So this is no cost to you. So even if you are waiving all coverage, we always recommend at least going into ADP and reviewing your beneficiary information annually to make sure there are no changes. Telemedicine, if you enroll in one of the medical plans, there is a telemedicine benefit that is attached to all 4 of the medical plans that are available to you, which we'll review later. A free employee assistance program. So even if you waive all coverage, you're not enrolled in any plan through Tampa JCC, but you're an eligible employee and you're enrolled in the basic life plan that's provided to you by Tampa JCC and Federation. You are eligible for the free employee assistance program, which gives you 3 sessions with a licensed counselor. That also is extended to your dependents as well. Value choice providers. So this is if you are enrolled in the medical plan. Florida Blue has something called value choice providers, which are Sunita's medical group, which give you lower cost care. Again, we'll review that in just a bit. And then the 401k retirement plan, there is going to be a separate meeting on the 401k. So there's information in the guide, but like I said, there's a separate meeting for that. So high level information in here, but keep an eye out for the 401k information that will be released during that meeting. And then earned wage access. So this is if for some reason you need a cash advance on your paycheck, there is an opportunity to do so through Pay Active. Again, more information throughout the guide. Next page is going to be the contacts page. So in the top box up here, Brown and Brown, you've got myself, Mary Murphy, and then Yazzie Diakate. So I'm your dedicated account executive over at Brown and Brown. Yazzie works directly on my team as well. And then we also have the insurance support hotline. So this rings our local office in St. Petersburg. And we have about 15 people who answer this line. And I always like to say that insurance is very confusing, frustrating, and expensive. Even though I work in insurance, I experience all the same issues that many of you do as well, with your claims being denied or getting bills that you don't understand, your premiums going up, etc. Happens to all of us, and it can be very frustrating. But luckily, we are the insurance consultants, and so I always like to extend our services to make sure that you are reaching out to us if you have any questions regarding anything around your benefits. So I got a bill I don't understand. I'm at the pharmacy. They're saying that I don't have coverage. I went to my doctor. They can't schedule. Just basically anything that is related around your benefits. Use us as the first line of defense to reach out to us and see if we're able to help. I would say 95% of the time, we're able to help you without ever having to send you directly to the carrier. So that's my little spiel there. And then if we move right below, if you are so inclined to reach out to the carrier, you are more than welcome. We've got all of your benefits listed here with the applicable carrier, phone numbers, and website addresses. But as I mentioned, you're welcome to anything that we talk about will always be confidential. So you are welcome to reach out to us at any time, help you navigate through your benefits plan and any issues you may come across. So how to enroll. So page 5, we're on for how to enroll through ADP. So you will make all of your elections, open enrollment elections through ADP. This is a passive enrollment, meaning that all of your current elections, if you do not log into ADP by June 9th, all of your current elections will roll over outside of the FSA. So the FSA requires action. If you would like to enroll in that plan, re-enroll in that plan, you need to make sure that you get into ADP by June 9th and make your FSA election. Outside of the FSA, if you don't participate in that and you want everything to renew as is, if you do take no action, all of your current elections will roll over. Okay. But again, just like I gave my disclaimer in the beginning, if you let your elections roll over, you are locked into those until July 1 of 2026, unless you have a qualifying life event. So I always recommend, again, just getting in there, reviewing what your elections are, checking that beneficiary information, and just confirming that, you're happy with those elections going into the second half of 2025 and into 2026. Any elections that you make during this time period will take effect July 1st, 2025. So if you make any changes by the 9th, they'll take effect July 1st. And when you log into ADP, there will be a pop-up with an OE message. And if you do want to make any changes, you'll select Manage Enrollment, which is in blue, and then you'll select Make Changes, which is also in blue. Okay, moving along, we've got just some additional information regarding your medical care information. So this is just a reminder that urgent cares versus emergency rooms. Urgent cares are a great resource to have if you need immediate care, but it doesn't warrant a emergency room visit. So we always like to use the term life or limb, meaning that if you are having a life-threatening emergency like chest pains, absolutely go to the emergency room. Or if you have a limb hanging off, you should also go to the emergency room. Outside of life or limb situations, you should be utilizing care elsewhere. And urgent care is a great benefit. It will cost you less money and less time as well. If any of you have ever gone to the emergency room, you know how costly and how timely it can be. You're also in a room with many people who have a lot of ailments as well. Urgent cares have shorter wait times, and like I said, it's going to cost you significantly less. Many of them also have imaging. They're able to do stitches. Many of them also have like durable medical equipment like crutches and wheelchairs. Of course, it depends on which urgent care you go to, but many of them are very robust. So just a reminder there to make sure that you're utilizing those urgent cares when you can, outside of life or limb emergencies where you do need to go to the emergency room. Save money by using mail order. So this is just a reminder that you do have mail order available to you if you enroll in the medical plans. So let's say that you take a tier 1 medication, that's $10. Once you go to the pharmacy for 3 months, you will pay $30 for that medication. But if it's a maintenance medication, cholesterol, heart medication, contraceptives, etc., a lot of times you can get those via mail order. And basically, instead of paying $30 over the course of 3 months, they mail you a 90-day supply and only charge you 2.5 times your copay. So in this case, that would be $25 versus $30, and it gets mailed to you instead of you having to go 3 times to pick it up. So just a reminder there. Next is the different amounts for procedures. Florida Blue does have a cost estimator on their website if you're trying to compare costs for different procedures that you may be having. And then preventative care, all 4 of the medical plans, including the high deductible health plans, all include preventative care covered at 100%, meaning no member responsibility. So at a minimum, I always like to tell people, if you are enrolled in the medical plan, you should at a minimum at least be getting your preventative care visits done. That includes your well visits, your annual exams, your well women's exam. If you have children covered under your plan, well baby, well child visits. Many tests such as blood pressure, diabetes, cholesterol are covered. A lot of cancer screenings depending on your age, mammograms, colonoscopies, and many routine vaccines as well. All covered 100%, no cost to you, even on the high deductible health plan. So please make sure, like I said, at a minimum, you're at least getting those wellness exams underneath your medical plan annually. Next is going to be the comparison between the HMO and the PPO. So Blue Care plans are HMO plans, meaning that they are Florida only plans. You do have to select a primary care, but you do not need a referral for a specialist. You're also able to update your primary care at any point during the month. So I know sometimes that concerns people, but HMOs today are not the HMOs of the early 90s. They're not nearly as restrictive. However, and there is a very large network. However, you do not have out-of-network benefits, and it is a Florida-only plan. So those are the 2 biggest takeaways about the HMO. If you are traveling outside of the state of Florida and you have a life-threatening emergency, that would be covered as in-network. But anything outside of a life-threatening emergency you would have no coverage. So if you're out of state and you get a cough, or you want to go to the chiropractor, you can't do that. There's no network outside of the state of Florida. For the PPO plan, that's your Blue Options Plan D. That's your national network, available in all 50 states, also includes out-of-network coverage. Moving along to compare the medical plans. So plan A and B are your traditional copay plans. So the quick 3-minute version that I kind of want to touch on before I go into the plan design is that this year, once we got your renewal increase, it came in at a 23%. We were able to negotiate it down to an 8.9%. In 2024, Tampa JCC and Federation increased their contribution by 5.8%. And then this year in 2025, they increased it by 11% to help mitigate that overall 8.9% increase. On average, they contribute about 64.7% of the employee-only cost. So 64.7% over the 4 plans. That would be 65% on Plan A, 61% on Plan B, 77% of Plan C, and then 54% on Plan D. Again, that's for the employee-only rate, but they are doing their best to increase those contributions to make sure that the increase not only to the company but to the employees is manageable. So I wanted to make sure that we notated that. So back to the plans, these two are your traditional copay plans. At the very top, that's going to be the employee contributions per pay. That's on a per pay basis. You get 24 paychecks. And then down below, we've got the actual benefits. So this is just a brief description. If you would like the full summary or full certificate, again, those are all going to be in ADP under the forms section under documents. So both are on the Blue Care Network. Again, you do need to select a primary care for either of these plans. You do not need a referral for a specialist. On Plan A, we've got a $5,000 deductible. On Plan B, we have no deductible. Both have 80% coinsurance, and then the max out of pocket on Plan A is $7,900. On Plan B, it's $8,700. So one thing that I always like to notate about the deductible is in a calendar year, I believe it's somewhere under 5% of people actually end up meeting their deductible. It's different than your homeowners or your car insurance, where anytime that you need to make a claim, you have to pay the full deductible. In health insurance, some services are subject to the deductible and others are not. However, anything that applies to your deductible also applies to your out of pocket. Okay. So just think about it as we go through, and I'll try to explain that further as we keep going. But I know that these are large numbers, especially when we look at the out-of-pocket maximum, but just keep in mind that that is a true stop loss. So in a calendar year, if you have $10 million in claims, you would either be capped at $7,900 on Plan A or $8,700 on Plan B. Okay, so let's go down. So on these traditional copay plans, not everything is going to be subject to your deductible. You have set copays for certain services. So for example, office visits. If you visit a value choice provider, that would be a $0 copay. So again, those Sanitas medical groups, that would be a $0 copay. If you go to a primary care on Plan A, it would be a $10 copay. If you go to any primary care just in the Blue Care Network, on Plan B, that would be a $45 copay. Your specialist is going to be a $100 copay on Plan A and $85 on Plan B. Again, those preventative services are all covered 100%. Moving down to the urgent care. So I know we touched on this briefly. If you go to the urgent care, any urgent care, it's going to be a $75 copay on Plan A or $125 on Plan B. However, if you go to a value choice provider, so the Sanitas medical groups, your urgent care visits are going to be $0 for the first two. Okay, so the other copay would apply if you go to 3 visits out of Sanitas, but if you just go to any urgent care, this copay would apply. Your labs and x-rays. So labs are going to be covered 100% under both plans. X-rays and diagnostic testing is subject to this $5,000 deductible, and then 20% not to exceed that out-of-pocket maximum on Plan A. So what does that mean? If I go get an x-ray, are you telling me I have to pay the full $5,000? No. That means that it's subject to it. So when you go to, we'll just as an example, use Tower Imaging. Let's say that you need to go get an x-ray and you go to Tower Imaging. Well, Tower is in network with Florida Blue. So when they're in network, that means that they have something called a contract, and they have contracted rates for certain services. So when the providers bill the carriers, they have diagnosis codes and the codes that they are submitting for payment. Okay. So what happens is when you go into Tower, you've got your x-ray prescription, you're going to take it up there and they're going to say, okay, well, we can see that this is subject to your deductible. Your deductible is $5,000, but our contracted rate for this x-ray is $100. You would pay the $100 and that comes off of your $5,000 deductible. So now it's $4,900 and your out of pocket would be $7,800, if that makes sense. So they basically, whenever you see deductible, just know that you're getting the contracted rate between the facility or the provider and Florida Blue. So it can vary. So Tower might be $100, and if you go to, I don't know, a different imaging center down the road, it could be $200. So, you know, it just varies from provider to provider, but that's what that means. So you don't have to pay the full $5,000 up front. You're just subject to that deductible, meaning, again, that you're going to get those contracted rates. So keep that in mind when you see that, when we're looking at the different plans. So If we look at advanced imaging, outpatient, inpatient hospitalization, all of those are subject to that $5,000 deductible. If for some reason you do meet this 5,000, like I said, it's very unlikely, but in the event that you do, we all have bad years, have things go on, so it's possible. In the event that you do meet your $5,000 deductible, you then are subject to coinsurance. So what does that mean? This 80%, that means that then after you've met this deductible, this 5,000, that Florida Blue will pay 80% of the bill and you pay 20% until you reach this out-of-pocket maximum. So what does that look like? In the example that I gave with the x-ray, let's say that I've met my deductible, I had a surgery or a couple surgeries. Anyway, I met my deductible. Now I've got to go back to Tower and get that x-ray again. Okay, so same x-ray, same diagnosis code, same everything, and I need to go back and get it done. Well, if the contracted rate was $100, it's still going to be $100. However, you've now satisfied your deductible. So you only have to pay 20% because Florida Blue is going to pay 80. So they pay 80%, you pay 20% until, again, that out-of-pocket max is reached. Once your out-of-pocket max is reached, then the plan pays, or Florida Blue pays 100% for all services for the remainder of the year. Okay. And again, even though you guys renew in July, the accumulations of the deductibles and the out-of-pockets accumulate on a calendar year basis. So from January to December. And then also I want to highlight is the mental health. So this is unique to Florida Blue on the copay plan. So plan A and B specifically, all of your mental health services are going to be covered 100%. This includes your psychology, psychiatry, even inpatient hospitalization that is due to mental health or substance abuse is 100% covered. No copay, no deductible, no member responsibility. So I always like to really highlight that because that's a great benefit that Florida Blue offers on its copay plans specifically. So make sure that you're utilizing that benefit if you have any mental health needs. Emergency room. So again, this is going to be a $250 copay. And then basically, so when you go at time of service, you're going to pay that $250. And then after you make the $250, your emergency room visit is still subject to your deductible. So I don't really know why they throw in the $250 in there, but anyway, you pay $250 at time of service, and then you still get a bill in the mail that's subject to your deductible for emergency room. When we look at Plan B, and then also the prescriptions at the bottom, just want to highlight this again to make sure that, we touch on that these copays are not subject to deductible. So if you have a tier 1 medication, it's going to be covered under $10. Preferred brand will be $50, non-preferred brand will be $80, and then your specialty will be 20% your responsibility. Again, contracted rate for the specialty med, you pay 20%, all gets applied to that deductible and out of pocket. On Plan B, so there's no deductible on this plan. The coinsurance only applies, so that 20% is only going to apply for certain services under this plan. So your, I think it's hospice, durable medical equipment, and a couple other items under the plan where that 20% comes in. But for the most part, this plan has all copays. So I know we already went over the office visit and the urgent care, but when we look at labs, I think that's where we left off on this plan. Labs are covered 100%, but if you have any x-ray or diagnostic testing, that's going to be a flat $100 copay. If you need any advanced imaging, like a CAT, PET, or MRI scan, for example, those are going to be a flat $500 copay. Your outpatient surgical services, so outpatient surgery, is going to be covered under a $1,500 copay. Hospital services is a $1,500 per day copay with a 4-day max. So that doesn't mean that they'll kick you out of the hospital on day 4. That just means that your copay only applies for 4 days. So if you're in there for 7, they're only going to charge you for 4 days. So the max that you would pay for an inpatient hospitalization would be $6,000. Again, all of that gets applied towards your out-of-pocket. Mental health, again, covered 100% under this plan. That's all inpatient and outpatient. And then emergency room is going to be a flat $1,000 copay. Same goes for the prescription drugs on this plan as well. So $10 for generic, $50 for preferred, $80 for non-preferred, and then specialty is that 20%. And then again, a reminder on that mail order drug being at 2.5 times retail. Moving along to the high deductible health plans. So we've got Plan C and Plan D. Biggest difference between the two is going to be the network. So again, Plan C is on that Blue Care, Florida only, need to select a primary care, no referral for a specialist network, whereas Plan D is on the national PPO Blue Options network. So again, Blue Care is Florida only, Blue Options is national. And then also Plan D has out-of-network benefits as well. So again, difference here is between the deductibles as well. Plan D has a lower deductible at $1,650, whereas the Blue Care plan has a $3,000 deductible. Coinsurance on Plan C is going to be 70%. So again, if you meet this $3,000, then Florida Blue comes in and pays 70%. You pay 30% until you reach that out-of-pocket maximum of $6,550. On Plan D, we've got a $1,650 deductible, 80%. So Florida Blue pays 80%, you pay 20% until you meet that out-of-pocket maximum of $5,100 for an individual. And then if you look at the benefit attributes on both of these plans, you can see that everything is subject to deductible. So that's how high deductible health plans are structured, is that everything is subject to deductible. And someone might ask, well, why would I want to be on a plan like that? Seems like catastrophic coverage. And that's not necessarily the case. One of the biggest benefits to enrolling in a high deductible health plan would be that you can pair it with an HSA account or a health savings account. This is money that you pre-tax, so it's a separate deduction, not included in the deductions listed above. But it's a separate deduction that you can put away money for your medical and or dental and vision expenses. So I always like to use the example, if you take a medication that you pay $20 every single month for, and you know that you're going to pay $20 every single month for, why not, pre-tax the money? So, have it be pre-taxed and then pay for it with pre-tax money instead of your after-tax money. And I know I had a question come up about how that works when we're talking about pre-tax. If you make $1,000 a week and let's say your benefits cost you $50, if it's a pre-tax benefit, that means that instead of the full $1,000 being taxed, that only $950 gets taxed. So we're lowering your taxable income while also providing a benefit. So medical, dental, and vision are all pre-taxed benefits. But to my point of talking about the health savings account, you can put additional money into an account, comes in the form of a debit card. It's a personal bank account where you are pre-taxing money into this account that you can use for your medical expenses. So going back to my example, if you pay $20 a month, you're going to pay that $20 a month. Why pay for it with your after-taxed money if you can pre-tax it? I think it just makes a lot of sense. And like I said, you're lowering that taxable income. We'll go a little bit more into the health savings account in a bit, but just wanted to notate that here when we're looking at the benefits, because as you can see, outside of preventative care on this plan, every single service is going to be subject to that deductible and then coinsurance. Okay, so again, contracted rates for every single service, your office visits, your urgent cares, labs, x-rays, hospitals, etc. The copays that are listed under prescription is after this deductible is met. So you will need to meet the deductible before you get that $10.50 or $80. But up until that point, same thing. If the contracted rate for your generic medication is $20, you pay that $20 until your deductible's met. Once that deductible's met, you would get the $10. And then, like I said, every service on the plan after deductible is met would be subject to the coinsurance. So Florida Blue either pays 70 or 80%, you pay 30 or 20%, depending on which plan that you're on. Moving along to the medical plan value adds. So this is just a reminder of Sunita's medical group that is available to you. All Florida Blue providers, I'm sorry, participants, I should say. You have locations in Hillsborough and Pinellas County available to you. And the nice part about Sunita's medical group is that they have late hours, weekend hours, and Spanish speaking as well. Many of them have, I think there's another page on this, but many of them have, primary specialists, urgent care capabilities, also labs, x-rays, imaging. You would want to check your specific location to make sure that all of those are available. But if you go to an a value choice provider on plans A and B specifically, you will pay $0 for a primary care visit. But even if you're on a high deductible health plan, you will pay significantly less if you go to a value choice provider or the Sunita's medical groups because they're owned by Florida Blue. So their contracted rates are much less than, their regular network. So again, highly recommend checking one of these out if there is one close to you. And then the next page just has that QR code with the Sanitas, so you can find one close to you. And then again, just reiterating that they have primary specialists, urgent care, labs, imaging, and virtual visits available. And then just a reminder as well that you do have a Florida Blue care team available to you under your medical plan. So this is just a nurse basically that is available to you through Florida Blue. And that is nurses and clinicians who work hand in hand with your doctor. So you can have peace of mind knowing that Florida Blue cares. And basically they help you focus on your health goals and access to community resources. So we've got the phone number and website address if you'd like some more information on that. Moving along to the pharmacy and discount program. So the preferred pharmacy network with Florida Blue is going to be Publix, Walgreens, and there it goes. Publix, Walgreens, Walmart, and Winn-Dixie. So other pharmacies are a network like CVS, for example, but this is just their preferred pharmacy network, meaning that they have better contracted rates. So if you're on that high deductible health plan, you'll want to make sure that you go to one of these pharmacies because your prescription medications are going to be less cost than it would if you went to CVS, for example. But if you're on a copay plan, if you go to Publix or you go to CVS, it doesn't matter. A tier 1 is going to be $10 regardless. But just a reminder for those high deductible health plan participants. Also below, we've got Needy Meds, GoodRx, and Publix Discount Finder. So these are just some additional programs that are available for prescription discounts. My only disclaimer on these is that when you utilize those manufacturer coupons or go through one of these programs, many times it does not apply to your accumulations. So that deductible and out of pocket, it typically does not apply to that. So sometimes it makes sense, if you're on a specialty medication and it's going to cost you $500 a month running it through your insurance, but there's a manufacturer coupon through GoodRx that allows you to get it for $25. Many people will go, well, I'd rather save my $500 a month and just pay $25 out of pocket because there's a manufacturer coupon available. So again, just if you use these programs, it's not running through your insurance, it's not getting applied to your accumulations, but sometimes it makes sense to use those. Next is going to be Teladoc. So we touched very briefly on this. All 4 of the medical plans do have Teladoc, a telemedicine benefit available to you. On plans A and B, it's going to be $0, no cost. And then on plans C and D, the max charge is around $56. This gives you access to providers 24/7, 365. And these are licensed board certified doctors. They help you with things. We've got the examples of the covered services below, but they can help you with all sorts of things. Basically anything you would probably go to your primary care or maybe an urgent care for. I've used it several times myself. Basically, you fill out a little questionnaire, same thing that you would do if you went to the urgent care or your primary care. You know, what brings you in today? What ailments are you having? You fill out the questionnaire, and typically a doctor calls you back within 10 to 15 minutes. You can also schedule a call. Like one time specifically, I used it for one of my children, you know, because I wasn't sure if I was going to be able to send them to school or how they were going to feel in the morning. So I set it up to have them call me at 6 a.m. and they called me at 6 a.m. sharp. You basically do a video chat, either on your smartphone or on your computer, talk to a doctor, and then in an instance where they need to prescribe you medication, you also put in your preferred pharmacy. And if it, you know, your visit does warrant a prescription, they can just send in the medicine right to your preferred pharmacy. So it's just a way for convenient care. So I definitely recommend you can get through it through your Florida Blue app, or you can just download the Teladoc app directly. The only plus of going through your Florida Blue app would be that your insurance information will already be plugged in, whereas if you go direct to Teladoc, you'll have to fill in that information. So keep that in mind as well. Health savings account. So again, if you enroll in plan C or D, you are able to contribute to a health savings account. So I always recommend for anyone who is enrolling in a high deductible health plan to at least put something in your HSA, even if it's $5 or $10 a check, because the money does roll over from year to year. So there's no use it or lose it. The money rolls over year. So over time that can accumulate and be very beneficial for you. And the example that I gave with medical, you know, if you have to go get that x-ray and it's $100 and you funded your HSA $100, you just use the card at time of service to pay for that $100. Again, if you are picking up a prescription every single month, you know, that's $20 and you're funding your account $20 a month, and every single month you can use your card for that. It is as you accrue it. So if you're doing $20 every single check, after 2 checks, you've got $40 in there. So keep that in mind as well. You know, if you have a lot of things that come up, you know, day one, for example, you know, you're not going to have your entire annual contribution in there. It is, you know, as you go, every per pay. So you're able to pre-tax up to $4,300 for an individual or $8,550 for a family on your HSA. Also, if you're over age 55, you can contribute an additional $1,000 as a catch-up contribution. You use your debit card to pay for it. It's through Health Equity. It comes in a purple Visa. And then what happens if I don't use the money? It rolls over year. And if you were to leave Tampa JCC for any reason, the money belongs to you. So this is not employer money. This is a personal bank account. It belongs to you. You have to be enrolled in a high deductible health plan in order to fund the HSA. But let's say that you leave and you start a new job and you're on a copay plan, but you've still got $200 in this HSA account. You can continue to use the money in the HSA for your medical expenses until the money is gone. You just can't fund it anymore. So if you got money in there, you can keep using it. Or let's say that this year you go on the high deductible health plan, but then next year, you know, you got some big surgery coming up. So you want to get on that $0 deductible plan. Any money that you have saved in this account, you can use for any medical expenses moving forward. You can also use it on dental and vision as well. So if you've got a lot of dental work coming up, for example, this is a great way. Again, you're going to pay for it with your after-tax money. So if you're able to pre-tax it, it's just a really huge benefit. If you use it for any non-medical expenses, dental vision, then there is a 20% penalty. And you can also use it on your dependents as well. So even if they are not enrolled in the Tampa JCC high deductible health plan, let's say that your spouse has your spouse and children covered under their employer plan, your dependents are able to use your HSA money for their copays or their services as well. So overall, it's just a really great benefit. You just need to make sure, again, legally married spouse and dependent children are eligible to use the funds in your HSA account, even if they're not enrolled under this plan specifically. Flexible spending accounts. So if you're enrolled on plans A and B, so those copay plans, you do have an option to enroll in the flexible spending account. So the difference between the flexible spending account and the HSA, the health savings account, is flexible spending account. The money is available on day one, but there is a use it or lose it provision. So I always tell people, make sure that you do not overfund this account, because again, if you don't use it, you'll lose it at the end of the year. So biggest difference there. And then also the money is available on day one. So in a health savings account, if you're electing $500 annually, every paycheck put in X amount until you get to 500 at the end of the year. Whereas with the flexible spending account, if I elect $500, for the plan year, my employer funds it basically $500 up front, and I pay it back via payroll deductions. So a nice way to plan, again, if you have a surgery coming up and it's going to be subject to your deductible, or maybe you got a quote and it's going to be $2,000, you can pre-tax that $2,000, and then pay it back via payroll deductions, and then you've got it on this card that you can use at time of service. Dependent care FSA. So this is for any dependent care needs that you might have for like after school, daycare, summer camp, etc. You can pre-tax up to $5,000 each year per household for either single or married. But if you are married filing separately on your taxes, then the max that you can do is $2,500. So nice benefit there. I personally use that. If you know how much daycare costs, it's well over $5,000 annually. But again, you're going to pay the money with your after-tax money. So why not pre-tax it? The difference between the dependent care and the healthcare FSA is that the dependent care is the same as the HSA in terms of as you fund it. So healthcare FSA, money is available on day one. HSA and dependent care FSA, money is as you accrue it. Okay. All right, and then moving on to the dental plan. So you've got two dental plans that are available to you, the DHMO and the PPO. The DHMO works off of something called a copay schedule. So it gives you a very good idea of your member responsibility. So you can see these D codes that are listed. So when the dentist bills Humana for your dental services, they submit all of these codes. Well, on the copay schedule, it will actually show you for this D code, this is the member responsibility. So for D2750, a crown is $245. That means that that's what you pay as a member. So it really provides a lot of transparency, makes it very easy and you able to plan what you can and cannot do for your dental services. The only negative that I will say about the DHMO is that typically the network is much smaller. There's no out-of-network benefits either. So you have to stay in network. And like I said, the network is much smaller. A lot of times it's the bigger box dental stores, like Greenberg Dental, for example, that, have multiple dentists that come in and out and alternate from location to location. As long as you're okay with that, I just like to be transparent about it. And then also sometimes they can have longer wait times. You also need referrals for specialists as well. So those are my only disclaimers. I think that a lot of times people think the DHMOs are kind of like more crummy than the PPO, for example, but I disagree. I think that the DHMO, as long as, like I said about the network, and any qualms you might have there. Actually, if you need a lot of dental work, you'll end up paying less on the DHMO than you would on the PPO. So moving along to the PPO, both plans have unlimited benefit, meaning that you're not capped at 1,000 or 2,000, that you can get as many dental services as you need done, covered services in a year, and you're never going to be capped. So that's a really nice benefit on both of these plans. You do have a deductible on the PPO. It's a $50 that applies one time. And then your preventative services are all going to be covered 100%. Those are those exams, cleanings, x-rays, etc. Basic services, so full mouth x-rays, fillings, simple extractions, those are also covered 100%. So it's a really nice, rich benefit for both preventative and basic to be covered 100%. And then those major services, so, crowns, root canals, oral surgery, bridges, dentures, etc., are covered 60% by Humana, 40% by you. So, if you're, I don't know, root canal costs $1,000, Humana is going to pay 600 of it. You're going to pay 400 of it after your $50 deductible one time. Again, those accumulations run on a calendar year as well. So that will reset in December. So if you get some services done this year, you pay that $50. After December 31st, come January 1st, you have to pay, if you're still in the middle of treatment, you might have to pay that $50 again. And then ortho is available on the PPO 50% with a maximum benefit of $1,000 for dependent children only. Vision, I always like to mention that vision coverage is for exams, frames, and contact lenses. If you have any type of underlying condition that with your eye, that's going to fall under your medical plan. So your exams are going to be covered at a $10 copay. Materials, which include your single, bifocal, and trifocal standard plastic lenses, are going to be covered under a $10 copay. I wear glasses myself, and I know that where they get expensive is when you start adding on all the additional features for your vision plan, like, the anti-scratch, polycarbonate, etc. All of that is going to be additional charges outside of the $10 copay. For frames, you do get a $160 allowance and then 20% off the balance. So if you find some frames that you like for $200, they'll pay the first $160 and then give you a 20% discount on the additional $40. Contact lenses, $160 allowance, then 15% off the balance. My only caveat is that you cannot do frames and lenses and contact lenses in the same 12 months. So if you use the benefit this year for your frames and lenses, you would need to wait at least 12 months to utilize the plan for your contact lenses. You do get exams once every 12 months, lenses once every 12 months, and frames once every 24 months. Life and AD&D insurance. So again, Tampa JCC gives you one time your annual salary up to $35,000 at no cost to you. And then if you would like additional coverage, you can elect anywhere from $10,000 to $500,000. If you are a new hire, you can elect up to $100,000 with no medical questions asked. If you're a current employee that is currently enrolled with at least $10,000 in coverage, you can increase your election by $10,000 during open enrollment with no evidence of insurability. But if you waived the coverage last year and want to enroll this year, you will need to provide an evidence of insurability form in order to get that approved by Mutual of Omaha. You can also put coverage on your spouse and or child, anywhere from $10,000 to $250,000 for your spouse, and then anywhere from $2,500 to $10,000 for your child or children. The only caveat to that is that their election cannot exceed 100% of yours. So you can't put $10,000 on yourself and then $200,000 on your spouse, basically. And then we've got the worksite benefits. So we've got accident, hospital, and critical illness. So accident is a really great plan. I always like to advocate for this one because accidents happen and we can never predict them. So the way that this works, let's say, I always like to say cause and effect, you need to be treated within the first 72 hours. So I was riding my bike, I fell off, I shattered my ankle, whatever the case is. I tripped, I fell, I broke my leg. I was cutting a tomato and I sliced open my finger. Cause and effect. Within the first 72 hours. When you go for treatment, so when you go to the hospital, you're going to give them your Florida Blue insurance. You're going to go through all the things through your medical plan. But once you, go through all your treatments, maybe you had surgery, maybe you rode in the ambulance, whatever the case was, once you get through all of that, you would file a claim with Allstate, provide your medical records, and then they go through line by line and they cut you a check for your applicable benefit. So let's say that you're hospitalized due to the accident, they'll write you a check for $2,000. If you were in there for additional days outside of one, then they will give you $400 per day, or ICU $800 per day. If you have surgery, you can get a benefit up to $1,500 depending on the surgery. If you rode in an ambulance ground, you get $200. If you had an X-ray, $200. Your initial treatment, $200. Any follow-up visits, $100. Now there are caps and maximums on all of these, but it's just really nice. Like I said, in the event that you do have an accident, or maybe your covered dependents have an accident, the idea of these plans is to help you supplement either lost time at work, maybe you had to miss a lot of work, or maybe you had those hospital bills once it ran through and everything's subject to the deductible or out of pocket, for example, to help you pay those bills. Or the money belongs to you. You can go shopping with it. You can go on vacation. The money's yours to do with what you like. So these plans pay you directly. And for the price, I think that the accident is fairly inexpensive. This is just a very brief summary of the payout. Again, the full list is in the forms section under documents in ADP. Hospital plan. So again, the accident plan has a hospital benefit, but that has to be due to an accident, whereas the hospital plan has a flat $2,000 benefit and then an additional $200 per day for hospitalization for any reason, like illness or pregnancy, for example. And then the critical illness plan pays you a lump sum in the amount of $20,000 for a covered critical illness. So these could be things like heart attack, stroke, major organ transplant, Alzheimer's, invasive cancer, end-stage renal, etc. So again, just a flat $20,000 if you have any of those ailments. So that's a really nice benefit as well. Again, all the rates for both life insurance and worksite are going to be in ADP because it depends on your age and who you're enrolling for those benefits. Employee assistance program. So wanted to make sure that we touch on this. Again, you do not need to be enrolled in any of the other plans in order to qualify for this. This is tied to your basic life benefit. So it's just a perk that Mutual of Omaha provides. Like I mentioned earlier, you have 3 visits with a behavioral counselor at no cost to you throughout the year. So it's a really nice benefit. We've got the phone number and the website address. Everybody goes through things, we've got a list here: stress, depression, parenting, financial issues, life changes, grief, mental health, whatever the case is, people go through things and people go through hard times. This provides you just 3 visits with a counselor at no cost to you, and it is also extended to your dependents as well. So great benefit there. Kind of takes out the legwork of you having to go find a provider. You can, they already have people staffed and ready to help locate a provider that would fit your needs. So definitely make sure that you utilize that benefit if you have any need. There's also the Legal Shield and ID Shield. So they both are available to you. You can either buy them separately or together. The price per pay is listed here. Everything that's covered under both of the plans is listed here as well. You do not enroll for this benefit on ADP. You do have to follow this website that's listed at the bottom to check out the resources or to enroll. But the per pay cost is listed here, and then the contact for that, Jan Tinder. If you have any questions regarding the legal or ID Shield plans, please reach out to her. We've also got the 401k retirement plan. Again, I'm not going to go too far into this. We've got the contact info for Mike, who helps with your 401k, but you need to be at least 21 years of age and have completed at least 90 days of service in order to participate. And all eligible new hires are automatically enrolled with at least 1% employee contribution. So highlights are just listed there, but like I said, reach out to Mike if you have any questions. Keep an eye out for the meeting that has all of the 401k information. And then lastly, we've got that pay active, frequently asked questions. Again, this is just going to be your pay advance. If for some reason you have a need for an advance on your paycheck, there is some options that are available to you through Tampa JCC. All the information is listed here on how it works, the fees, etc. So if you have a need for that, there's the QR code and then all the FAQs that are listed here. And with that, that will conclude my presentation. Again, if you're watching this during open enrollment, please make sure that you get in no later than June 9th to make any of those elections. If you are keeping everything the same, then your current elections will roll over outside of the FSA. So please make sure to do so no later than June 9th. And thank you all for joining. And I hope everyone has a great rest of your day. And talk to you later. Reach out if you have any questions. Thanks so much.